laugh so hard you peed your pants? You don't have to answer that. It's a serious issue. We're talking about urinary incontinence next with the doctor.
Well, Olivia asked the question just before the break. Ever laugh so hard that you peed your pants? That might make you giggle, but actually it's a very serious problem that a lot of women deal with every day. We're talking about urinary incontinence, and it's usually thanks to pregnancy, childbirth, or menopause. Dr. Angela DeRosa specializes in women's health. You were telling me 90% of women over age 30 have this. So while it's something that a lot of folks don't want to talk about, we're going to talk about it here, and you've got some answers and some help. So thank you. Welcome.
Oh, it's always a pleasure, because as much as men don't want to talk about erectile dysfunction, women don't want to talk about urinary incontinence. And I can tell you almost every woman that walks in my office has some degree of urinary incontinence.
Okay, explain what happens, because a lot of times it is because of childbirth or pregnancy, right?
Well, there's two types of urinary incontinence. There's urge incontinence, where you're running into the house, you're grabbing your keys, and you just can't hold it, and it just kind of comes out. And that's when the bladder is actually spasming and it's a muscular problem. But the more typical kind is called stress incontinence. And it's basically when you laugh, sneeze, or cough, you're working out and jogging, that the bladder is actually dropping. And what happens is that the pressure from pregnancy or even ongoing constipation and various other things causes that pelvic floor to drop.
Okay.
So it makes it much easier for that urine to come out. So you have that little bit of laughing, sneezing, coughing, and oh, there it goes.
Yes, yeah.
And it can be just anything from just a little bit of a dribble to some women just having a full emptying of their bladder.
Okay, well, let's talk about the treatments, because you don't have to just, and I'm going to just be, we'll just have some honest talk here. You don't have to just deal with pads, right?
No.
I mean, there are actual treatments that you can, and solutions that you can turn to.
Yeah, and I mean, everyone thinks about the little old grandmothers smell like urine, and that's from the pads. They've gotten much, much better, trust me, than they used to be. But that's certainly an option. But some conservative things, like Kegel Balls. So I know the one time I was here a couple of years ago, I was telling Scott he needed to get a pair of these. So these are the Kegel Balls, which are little weights you can insert into the vagina, and it causes the vagina to work out.
Okay.
And it strengthens that pelvic floor to lift it up, so it's a very nice conservative ways, and they come in different sizes, so you can actually strength train your vagina.
I see. So you strengthen the muscles so they contract, so that, so you don't.
And then other options are called Pessaries. And here's a couple more common. One looks like a donut, and then another one that's a square. You have specialists in urinary incontinence, gynecologists, urinary specialists, who can put these in, and they stay in anywhere from a few weeks to a few months, and it just lifts up the bladder, so it kind of creates a better angle so you don't have urinary incontinence.
And is that something that's permanent, or is it just...
You can take it in and out, and usually we take it out every few weeks, and we clean it and put it back in. So this can stay permanently in there. But obviously you can temporarily take it in and out, but it's a more permanent solution. And then there's other options, anywhere from medications for the urge incontinence, but the final resort is sometimes you need surgery to kind of lift that bladder, and that's called a bladder sling. But before you do that, you really need to know, do you have urge incontinence with stress incontinence, or a combination of the both? Because if you treat one without treating the other, you may make it worse. But there's called Urodynamic Testing. So you can come in to our office, or any office that specializes in, and find out exactly what issue you have and how bad it is.
And so the bottom line is, it's extremely common. Don't be embarrassed to talk to your doctor about it.
Absolutely not. Women are multitaskers. We can laugh, pee, and cough all at the same time.
There you go. And we can talk about it too. Dr. D, thank you so much.
You're
really
welcome.
appreciate it.